Hi, I'm Dr. Chan here at Crown Dentistry. We get a lot of questions about Invisalign, so today I'm going to talk about answering some of the questions that we get in order to help you better understand whether or not Invisalign might be right for you. So Invisalign is the latest in orthodontic technology. Invisalign is a way that we use to help you move and straighten your teeth. So a big difference between Invisalign and traditional braces is that Invisalign uses aligner technology. What that means, no metal brackets, no wires, nothing sharp, nothing pokey in your mouth. The way that Invisalign works is that we make a bunch of plastic trays or retainers, actually aligners, that we use to help move your teeth. What happens is you start using an aligner set, usually one for the top, one for the bottom. Then after a week to 2 weeks, you take those aligners out, and then you put another set of aligners in your mouth. This process continues until we've moved your teeth into the position and arrangement that you want. A lot of times Invisalign can be faster than braces, although for the most part it's a case-by-case basis. So there's a couple reasons why Invisalign is more comfortable than traditional braces. So for one, there's no metal in your mouth. Traditional braces generally, for the most part, have always used metal brackets that are glued to your teeth, as well as metal wires. These are the parts of technology that are used to move your teeth. Invisalign uses soft plastic trays to move your teeth. Occasionally, we might glue small plastic fillings onto the teeth that will help move your teeth a little bit better, but a lot of times it's just trays being used to move your teeth. Another reason why Invisalign is more comfortable than traditional braces is that the trays are removable. If for some reason you don't want to use trays for a night or two, they can be removed and you won't have anything in your mouth. A lot of people want to know how long Invisalign will take to straighten their teeth. I usually tell them on average it's between 18 and 24 months, but more specifically it's an individual case-by-case basis. Sometimes people take a little longer. Sometimes people can finish in less than 18 months. So we just have to take a look at you as a patient and take some digital scans, take some pictures, sometimes take some models and molds of your teeth, and then diagnose appropriately. After we do that, we can get a more specific idea of exactly how long treatment will take. One of the coolest things about Invisalign is that it's almost completely digital. What that means is that we don't have to take physical molds or models of your teeth if we can get away with it. We use a machine called an iTero to take a whole bunch of pictures of the teeth and gums. And when it does that, it basically recreates your teeth, your gums, your mouth in the computer. And once that's done, then we can create a proposal of how we're going to move your teeth from where they are now to where you want them to be. So Invisalign trays, that's kind of what we were talking about earlier. We also call them aligners. They're basically a bunch of plastic retainer type devices that you'll be wearing on your teeth. Usually there's one for the top and one for the bottom. We usually have our patients wear them anywhere from 7 to 14 days, depending on how much we want your teeth to move or how much they need to move. After that time period, you switch to another set of trays. We generally give our patients anywhere between 4 to 6 sets of trays. So that's 4 on the top and 4 on the bottom. We generally tell our patients to wear or shoot to wear their trays for 22 hours a day. What that means is that you should be wearing your trays all the time except when you eat and except when you brush and or floss your teeth. We always tell our patients, the more you wear your trays, the faster and better the treatment will go. We always want our patients to have the healthiest mouth possible before starting Invisalign treatment. What that means is we want our patients to be cavity-free, and we also want our patients to be gum disease-free. So we need to take a look at all of our patients first and clear them before starting treatment. If you do have gum disease and or cavities, it's okay. We can take care of that, but we just need to make sure that everything is healthy before you start Invisalign treatment. For the most part, Invisalign is pretty comfortable. I'm not going to lie and tell you that you're going to feel nothing when you're going through Invisalign treatment, sometimes people do experience a little bit of soreness, especially when they're first starting out and or when they change into a new set of trays. Usually, the soreness and or discomfort, though, is minimal and is easily managed with either warm salt rinses or taking Tylenol or ibuprofen. So a good question that sometimes people ask is if Invisalign can fix a crossbite or not. So a crossbite is when your bottom teeth are outside of your top teeth. In a generally healthy, normal bite, your top teeth should be wider or outside of your bottom teeth. The answer is that Invisalign can correct that particular oral defect. So for the most part, Invisalign is covered by some insurances. The way that we would take care of that is that we would have our front office treatment coordinators submit the Invisalign treatment to an insurance company if you do have insurance coverage, and we would submit the necessary documents and narratives in order to see if your insurance company has orthodontic coverage. A lot of patients ask if Medicaid covers Invisalign. With everything that is Medicaid related, it's very much a case-by-case basis. In order to prove whether or not a patient is covered through Medicaid for Invisalign, we would have to prove medical necessity and or submit a narrative and or x-rays in order to get coverage. That being said, at the present time, our office does not accept Medicaid. At present, Crown Dentistry charges $5,850 for Invisalign treatment. If you're at the point where you're ready to consider Invisalign treatment, please call our office at 916-285-9678, and we can answer any questions that you might have and get you scheduled for an introductory diagnostic appointment. Or you can also go to our website at www.crowndentistry.net.